This video will cover the criteria that we have for selecting patients suitable for operations and anaesthesia at our peripheral hospitals. It will cover why we have the guidelines, what's contained within the guidelines, and why these are just guidelines and can sometimes be altered for individual patients. So why do we have these guidelines? First of all, there are limited diagnostic capacity at our peripheral hospitals. If there is an emergency or complication during the patient's operation or afterwards, we have limited specialist services to be able to best deal with that. And the overnight cover in our peripheral hospitals is limited, particularly from a specialist medical point of view. For these reasons, we therefore need to be careful to select patients that are generally fit and well, or who have stable, well-controlled chronic disease and are therefore at low risk of complications. And we need to screen out those with more significant or unstable disease who may pose a higher risk. Our criteria in our printed guidelines cover a number of specific domains. First of all, exercise capacity. Those who have a good moderate exercise capacity and are able to exercise the equivalent of 3 METs, which would be approximately walking at a steady pace on the flat without symptoms, would be suitable. Those with more significant impairment of exercise may be suitable in some cases, and their notes should be reviewed by the anaesthetist if there is uncertainty. In terms of cardiovascular criteria, patients who've had coronary artery bypass grafting more than 6 months ago but less than 5 years ago are suitable. Those with a coronary stent in place for more than 1 year but less than 5 years would also be suitable. And patients who have chronic, stable, well-controlled atrial fibrillation, hypertension and angina would also be suitable. Those that would be unsuitable are patients with severe, untreated or not investigated disease, or disease that is unstable. Patients with permanent pacemakers or implanted defibrillators are not suitable, and those with prosthetic valve. Respiratory disease. Patients without significantly impaired baseline tests would be suitable. Those with mild, moderate disease which is stable as evidenced by a lack of symptoms or hospital admissions requiring treatment are also suitable. Renal impairment. Patients who have chronic, mild impairment of renal function, EGFR more than 50, would be suitable. Type 1 diabetics. Patients who have demonstrated good long-term control, undergoing day case procedures for surface anatomy surgery, who are able to eat immediately post-operatively, are suitable. Others would not be. Neurological conditions. Patients who've had a CVA more than 6 months ago and patients with long-term, stable, well-treated neurological conditions that do not significantly impair mobility are all suitable for peripheral sites. Unsuitable patients would be those with drug or alcohol dependence, particularly if there is a high risk of withdrawal, and patients who have long-term complex pain issues. Obesity. Patients undergoing major joint surgery or laparoscopic procedures ideally should have a BMI of less than or equal to 35. Patients undergoing hand or upper limb procedures which are suitable for regional anaesthesia. Patients having eye surgery or surface anatomy surgery should have a BMI of less than 40. These criteria are certainly not rigid, and variance can be applied after consultation with the anaesthetist. It's also important to note that particularly breast cancer surgery patients may significantly benefit from an operation at a peripheral site. Exceptions may often be applied in these cases. There's also other groups of patients which would be excluded. These include those with significant bleeding disorders, positive MRSA screens, pulmonary embolus or DVT within the last 3 months, or frequent recurrences of such problems, and patients who have significantly deranged blood tests would also be unsuitable. It's really important to recognise that these are guidelines and should be used as a guide only. It is quite possible to safely operate outside of these criteria in carefully chosen selected cases. This is really important because we have lots of people waiting for surgery. Our peripheral sites have shorter waiting times and we have available capacity that we should utilise wherever we can. As with many things in healthcare, selection is a balancing act of weighing up the risks and benefits of any particular action. If you see a patient who is not quite meeting the criteria but you feel that they may be suitable for a procedure at a peripheral site but are unsure, please refer the notes to the anaesthetist asking about site suitability.